Tomorrow's New Year's Eve, and a lot of people, they're already making lists of their resolutions for the new year. Many of those revolve around health, things like maybe working out more, losing weight, or eating healthy.
And those are all great goals, and we know the health of our brain and our body are intertwined. Joining us today is Jim Herlihy, Vice President of Communications for the Alzheimer's Association in the Rocky Mountain region. Thanks so much for coming in.
My pleasure.
Really appreciate it. So before we get into specific steps that people can take, of course, to support their own brain health, remind our viewers how significant of a health issue Alzheimer's disease is for us.
Well, there's 91,000 Coloradans among 7 million Americans living with Alzheimer's. It's the 7th leading cause of death and the only major disease without a prevention or cure. So we've
puts it into perspective a little bit.
Yeah, and there's a couple 100,000 Coloradans who are providing day-to-day care for their loved ones. 80% of those are in the home.
Right.
So a lot of that's happening while people are either living their lives or working. So that's a lot of responsibility.
Sure is.
Absolutely. Well, last year, Jim, the National Institutes of Health spent $3.8 billion on Alzheimer's research. Talk about how important this research is to finding treatments and cures.
Well, they've made great strides in terms of earlier diagnosis as well as treatments. But the key is that there's about 40% of the cases of Alzheimer's can be affected by how we live our lives. So it's the diet and the exercise that you talked about. We can either reduce our risk or we can enhance our risk, depending on how we approach that.
So talk about specific steps that people can take, New Year's resolutions for brain health that we can do.
Well, a couple minutes ago, you were talking about fire danger, and that's a key one that we learned about this year, that we can't control what's happening outside in the environment, but we can control what we're breathing in. So when we're at home, we can have high efficiency filters on our furnaces that can filter that out. And when we're going outside, just like we did during COVID, we can be wearing an N95 mask. If we have to go outside during those high smoke times, we need to be controlling what's going into our lungs.
Okay. Very interesting. Talk about some other lifestyle factors and things we can do differently as well.
Well, there's a couple of pretty easy things that we can be doing. One is getting vaccinations. I mean, something, it's a little bit controversial right now, but research has shown that among older adults, getting both a flu or a pneumonia vaccine will each reduce risk by about 40% for developing cognitive decline. There's hearing loss. About 2/3 of adults over the age of 60 suffer from some amount of hearing loss. And studies have found that people who use hearing aids for a couple of year period have reduced that hearing loss by about 2/3. Hearing loss is correlated with dementia because people's brains have to work harder. They withdraw from social interaction, which is kind of a domino effect for developing Alzheimer's.
You've talked a lot about, these ones are kind of hard for us, but you've talked about sleep and processed foods, some of the things that are really attainable for us to change right now that can help out brain health as well.
Yeah, and we have talked about this, and processed foods, the baked goods, the highly processed foods, even things like bacon. I mean, some of our favorites.
I know.
When you look at this latest study said that if you have more than 4 slices of bacon a week or 2 pieces of sausage, you are elevating your risk of dementia.
Wow.
So, I mean, it's that old maxim, all good things in moderation.
Right. Yeah,
Oh, my
big time.
goodness.
And then what about sleep? I know sleep's important, and we've talked about coffee too, which that's the one that I
That's
like.
hard.
Yes.
Yeah.
But the coffee, they say, is actually kind of good, right?
Coffee is shown, I mean, it's correlation and causation, whether or not it's the cause, but it's correlated with lower risk for dementia. So people who are drinking more coffee are seeing a lower incidence of Alzheimer's.
Keeping us sharper, maybe, a little bit more awake, Jim?
I'm not sure I can't interpret that for you.
Oh, man. So you were talking about the caregivers. I can't imagine how hard that job is. Talk about, if they're sitting at home and they need help, where can they go for resources?
Well, we've got a lot of free education information on our website, www.alz.org, and we've got a 24-hour helpline. It's staffed by trained professionals, 800-272-3900. If in the middle of the night, the person you're caring for has a crisis, or if you just need to figure out what's happening, I don't understand this change in behavior. Because it's important to realize Alzheimer's is an evolving disease. what is happening today may not be what's happening tomorrow or next week.
Yeah.
And so people don't understand this if they've never been through it. So you need to talk to somebody who understands the process.
Yeah. Great advice.
Thank
Jim,
you so much.
My pleasure.